Okay, we're good. I'm Dr. Frank Patino. Thank you all for coming today. Appreciate that you take the time off your day to come here and listen to what Peter and I have to say. I'm a medical doctor. I went to medical school at the University of Florida. I trained in internal medicine. After that, I did a fellowship in sports medicine. I also worked in the emergency room for 17 years. So at one point, I was triple board certified internal medicine, sports medicine, and emergency medicine. I've always had an interest in nutrition and health because of the sports medicine aspect. In addition to that, as an internist, I realized that a lot of what you do with your body, how you eat, and whether you exercise or not, has a lot to do with your general state of health. So it's all interrelated. We're talking about heart health today. Let me tell you a little bit about myself. I didn't speak English till I was 6 years old. I came from a foreign country, Cuba. I was born there. I lived in what I thought was paradise. My parents owned a sugarcane plantation. And everything was wonderful for the first 6 years of my life. I thought I was living in this paradise and it would never end. Well, it did come to an end one day. And in the form of military trucks. They pulled up. They surrounded the house. They arrested my father. They put him up in front of a firing squad right there in the side of the house, right in front of me. And the idea was that they wanted him to give up the names of the co-conspirators who were trying to keep communism from taking power in Cuba. Well, my father knew well that had he given up any names, he would have still died and so would they. So he never gave up any names. What my father did is he just shut up, and he knew that he had to do what he had to do. I was 6 years old, standing there watching this. This is the day my paradise ended. I was frozen. I did not know what to do here. These guys had AK-47s. They were completely decked out like stormtroopers. And that was it. We lost the ownership of the farm because it became property of the state. My father was arrested. They shot over his head twice in an attempt to make him speak, but he never did. So here's the first lesson in life, is that you do the right thing regardless of the consequences. So my dad did what he had to do, and I learned firsthand, as hard a lesson as it was, that you do what's right regardless of the consequences. He could have given up names. He could have done what they wanted him to in an attempt to save his own skin, but he didn't do it. And I saw this, I was witness to that. So firsthand I learned that this is how you behave in life. You do what's right, no matter what. Now my mother had 6 children at the time. I was the middle child, and all of us were under the age of 10. My father being in prison, the property taken away from us, we had no place to go. My mom didn't want to leave Cuba because she didn't want to abandon my dad, but he made her promise to get us out of there because she couldn't do anything for him. He knew his situation was terminal. So she took the 6 children and we came to this country. When we went to the airport in Havana, we had one suitcase for all of us, my mom and the kids, a little bit of clothes for everybody. They took that away from us. They ripped the wedding ring off her fingers, and we were off. So we landed here in June 1961 with the clothes we were wearing, and that was it. Now my mom had a decision to make. She had to raise 6 children. And what she did is she taught herself shorthand. She taught herself how to type on an old Smith Corona. And she refused welfare. She told us she didn't want us to ever feel that anybody owed us anything. And she wanted us to grow up knowing that we had to work and strive and be dedicated to achieve what we needed to and not rely on somebody else to give it to us. So she did. She got a job. She worked. We were poor. We didn't have a lot. And we bought a lot of hand-me-down clothes from people that were nice enough to send them to us. But we learned the hard way, and we learned a good lesson that you succeed by working hard, not by putting your hand out and hoping everybody else works and hands it to you. And all the kids, all 6 of us learned that lesson, so that We all succeeded in life. We all went somewhere. We didn't become wards of the state. So I went to medical school. Another brother has a master's in electronic engineering. Another one is a captain on a 767. My sister had a master's in elementary education. So we all went and succeeded based on what we saw from our parents. I say that to say this because we can tell you a lot about medicine and we can tell you a lot about physiology. And if it's not in your heart to do this, it doesn't mean anything. Having the knowledge is only part of the answer. You have to put it into practice. And putting something into practice sometimes takes a lot of dedication. This world programs you to fail. It doesn't tell you you can make it. It doesn't tell you you can succeed. It tells you to be lazy. It tells you to wait for the handout. And it tells you you're never going to make it. Well, you have to overcome that from your heart. And you have to apply yourself and say, yeah, I can do that. I have value. I was created with value. I don't have it because of my social status or any other status. I have it simply because I'm here. And so you matter. You matter to the creator of the universe, and you should matter to yourself. So using that, you can overcome, you can apply yourself, and you can make these things work for you. So let's talk about heart health. When I was a firefighter years ago, when I was doing my undergraduate work at the University of Miami, I decided it was a great idea to take my Harley, along with my buddy Bulldog, and go through Mexico, and cross Mexico from one side to the other. So here's the lesson I learned. We had great motorcycles. These are top-notch Harleys. We had them decked out. As soon as we got into Mexico and put 80 octane gasoline in that tank, I fouled the plug a few minutes later. Changed the plug, he fouls the plug. We're sitting there on the side of the road going, what's going on here? We got these great bikes and they're not running. Well, the fuel was horrible. It was about 80 octane. You pull up to your gas station here, your octane are 93, 90, 89, 87. You get down to 80, you're not going to do well. You can have the nicest car in the world, has the nicest interior, you can have the best sound system, you can have the best suspension system, you can have the best tires, the best wheels, and you don't have an engine that runs, not going anywhere. If the fuel that feeds the engine isn't getting good, you're not going anywhere. It's just going to sit there. Same with our bodies. We have a heart that supplies oxygen and nutrients to all the vital organs of the body. If we don't take care of that pump, it doesn't matter what everything else looks like. It's not going to function. You're not going to do well. You're not going to have a good life. You're not going to have a good quality of life. So we must keep this in great shape. So let's talk about that. The heart is part of a system that is what we call the respiratory cardiovascular system. And it's important to note that those three things work hand in hand. The heart being in the middle is the pump that pushes all the nutrients, all the oxygen to the vital organs. It uses the vascular system to get there, and the respiratory system is what oxygenates that blood in order for the heart to do that. So let's take a step back. Let's look at the respiratory system. The respiratory system consists of little air sacs we call alveoli. At this level is where you exchange oxygen, and if you breathe in from the air, and put it into the blood. So what happens when you do things like smoke? Those alveoli begin to rupture so that those little air sacs, as they rupture, become these big giant air sacs. What happens with that? Why is that important? Well, the surface area that the exchange of oxygen with blood takes place is diminished. Because if you have a million little air sacs and you blow those up and you have one giant air sac, what happens is that the surface area that used to be like this to exchange oxygen now becomes like this. And we call these blebs. And this is what happens with emphysema. That is the definition of emphysema. You get all these ruptures of these little air sacs, and you get these big giant air sacs, very little surface area, very little place for the oxygen to exchange into the blood, and that becomes a problem. The other issue is that you take the air tubes, the breathing tubes, we call the bronchioles or the bronchus, and they begin to get inflamed, and they secrete a lot of mucus, so they get plugged. And so you can't exchange air from the outside in. So now you create a big problem. You can't get air in, you can't get air out. The air that's in there doesn't have any place to exchange. So what we call your diffusion capacity drops down. The ability of the lungs to diffuse that oxygen into the blood diminishes. So now you're feeding the heart with 80 octane fuel because you've damaged the lungs, okay? So that has consequences, just like it does with a vehicle. When you start supplying it with bad fuel, it's not going to function well. The heart itself, the heart has to nourish itself. So it takes the very first amount of blood that it pumps out. It's the richest for itself. When the aorta comes out, you see the coronary arteries are the first things that come right out. So the first amount of blood that comes out of that heart when it pumps in the ventricle, it feeds itself. It has to. It has to keep itself alive in order to keep the rest of the body alive. So again, if you damage the heart, or if you don't strengthen the heart, or if you feed it fuel that's low in oxygen and doesn't have enough nutrients and oxygen, what's it going to do? It's got to pump harder, it's got to work harder in order to get more oxygen. But as it does that, what happens? The requirement for oxygen goes up. See? We call this the myocardial oxygen consumption. The myocardial oxygen consumption is what the heart needs in order to keep functioning. When it works harder, the need goes up. Well, as the need goes up, it can't feed itself anymore because the amount that it's getting is bad. And so you're creating a problem that feeds itself and it makes it's a graveyard spiral for the heart, okay? So the actual vessels that feed the heart, the coronary arteries, are nice, big, thick arteries. Like I said, take the first amount of oxygen that comes out of the ventricle, the oxygenated blood. So let me show you something real quick here so you understand. This is an object lesson. I was a firefighter before I went to medical school. And with firefighting, you have to understand hydraulics. It's about getting water to the source, okay? And you have to pump through hoses. And here's what's interesting. It applies to the physiology of the body. It's no different. If you take a coronary artery that has a lumen that big, that's nice, big artery, and you start eating inflammatory foods, high saturated fat foods, foods that are high glycemic, and you start developing atherosclerosis inside the vessel, what ends up happening is that the lumen is obstructed, becomes smaller, and eventually you end up with something like this. And this is what you have to feed the heart with. When you started out with something like this, and you end up with something like this, what's going to happen? You're not feeding your heart very much. If this is your coronary artery, and all you got is that little bit of lumen left, what happens? And I'll show you what happens at the fire department. We used to use two types of hoses. 2.5-inch hose, 1.5-inch hose. The 1.5 obviously smaller. At 100 pounds of pressure here at the nozzle, the 1.5-inch hose will give you 100 gallons a minute. Okay? The 2.5-inch hose at 100 pounds of pressure at the nozzle here gives you 250 gallons a minute. So you go from 250 gallons a minute down to 100 gallons a minute when you decrease just by 1 inch. Okay? Now, when you obstruct your coronary arteries by 80%, you're getting very little flow through that restricted movement. Okay? So what happens? Your heart requires this oxygen. So what's it going to do? It's going to work harder. It's going to pump harder because it needs more. It's not getting enough. As it pumps harder, it requires more because now it's really working. So the oxygen consumption requirement goes up. So it's requiring more. It has to deliver more, and it can't deliver more because it's obstructed. So what happens is that eventually you get into problems. The first starts to happen is you start getting pain because there's not enough oxygen feeding the muscle of the heart. So you get what we call angina pectoris, which is in Latin chest pain. So you start feeling it because your heart's working, there's not enough oxygen getting in, and you start feeling pain in your chest, shoulder, arm, and your neck. And that's a bad sign because that's ominous. That's telling you there's an obstruction, you got a problem, you better do something about it, because if you don't, what can happen is that plaque ruptures, and what causes that rupture is inflammation from inflammatory foods. When that ruptures, now you've occluded the entire lumen, so you got nothing. And with no oxygen getting to the heart, it's going to die within about 4 to 6 minutes. So now you've got a race to the hospital, you got to get that open, and it rarely gets open in time to save everything. Usually there's a amount that dies. And depending on how much of that heart tissue dies, determines whether you live or you don't live. And if you live, how much of a disability you're going to have, how much you're going to be crippled, because what's dead is dead, it's not going to come back. The stunned part of the muscle you may get back, but the dead part is gone. So we must keep these lumens open. Now when Peter comes up here, he's going to talk to you about exactly how that happens. I'm just trying to tell you that if you eat right and you do proper exercise, this is how you avoid some of this. And he's going to get into the specifics of that. When you don't do it, I'm telling you what's going to happen. And it's inevitable. Sure, genetics plays a little bit into it. You can abuse your body, and some of you are going to see your demise a lot quicker than others. That's a genetic determination. But it happens anyways. Whether it's slow or fast, it's going to happen. So you need to take care of your body. Peter will tell you that, you know, this is the one model year. He's going to talk to you about that. You can't trade it in to get another one. You abuse it, you mess it up, you got to live with it. So let's take good care of it, because this is what gives us our quality of life, our longevity too. Now the vascular system we just talked about. The coronary arteries feed the heart, the peripheral arteries feed the end organs. Same thing happens when you start occluding those arteries. The end organs, the brain starts to lack oxygen. The vital organs, the kidneys, the liver, everything else starts to lack oxygen, and so everything starts going down. So how do we avoid plaque formation? Eat low glycemic. Low glycemic keeps your insulin levels low. By doing that, you allow your body to burn fat as a fuel source, and you maintain a low body fat composition. It also prevents inflammation. High glycemic foods are pro-inflammatory. High saturated fat foods are pro-inflammatory. You have to stay on a proper nutrition in order to keep the inflammation down. Now, I'm not a proponent of fad diets. There are many of them out there, and you can lose weight with them. Here's the problem. If you've eaten in a way that's gotten you into trouble, and then you decide, I'm going to do a particular fad diet, and you do it, you lose weight, you will, more than likely. It may cost you a lot of money, it may not, depending on which one you do. What happens when you're done? You've reached your goal, you've lost your weight. Where do you go? Well, usually you stop the diet and you go back to doing whatever it was you did that got you in trouble. So what happens is you gain the weight back, now you're in the same situation, now you start a diet again, you choose that one or a different diet, and then starts the process of what we call the yo-yo effect. The weight's here, you do the diet, you go back to what you were doing, your weight goes back up, and you go back up and down. This is the yo-yo effect, not healthy. So what we tell people is if you have to do something that you can reproduce and that is sustainable in your life, you want a diet that's a lifestyle, something you can maintain, be happy with, be satiated, and eat food that you enjoy, but stay healthy. And that's the way you can do it. So by eating something, by eating nutritionally and eating glycemic, you can maintain that. Because a low glycemic index diet is not only healthy, but it also tastes good. Because all you're doing is eliminating high glycemic carbohydrates. And if you can do that, certain things like bread, very high glycemic pasta, all these things will elevate your insulin levels. Soft drinks. Soft drinks are just liquid sugar, is all they are. And when you put those in the system, your blood sugar shoots up, your insulin levels follows right with it. Those high insulin levels will get you in trouble. Those high insulin levels block the body's ability to burn fat, and it actually signals the body to store fat. So you got two problems with high insulin levels. And anytime you eat high glycemic, that's what you're going to get, in addition to the inflammation. So keep the inflammation down, but you must exercise. And exercise, there's tons of things you can do. My patient population, I have some morbidly obese individuals. I have a particular patient who refuses to exercise, refuses to follow the diet, but she continually, every week, asks me for advice. And I can't do it for her. So she'll sit in the waiting room with her McDonald's bag, stuffing down. I mean, seriously, I'll walk out there and it's like, what are you doing? It's not low glycemic. And then she complains about why she can't, walk and she can't do things. And she's a young lady. She's in her 30s. She ought to be able to do things. And what she wants is, she's gone from walking to using a walker. Now she wants to use those little hovercrafts. And I told her, I said, you're taking a step closer to the grave every time you do that, because the less you move and the less you exercise, the closer to the grave you are, and you're going to die young. And I can't help you because no matter what I tell you, you don't follow the advice. She doesn't have the capacity to do it. And so it's going to be a bad ending for her. But that's her choice. Your choice doesn't have to be that. Your choice can be to do the right thing. And so you have to be dedicated, and you have to have that inner drive that comes from your heart that says, I can do this and I will. And you can. It's not asking you to do something that's insurmountable. There's simple rules, and Peter's going to go over that with you. So I'm going to turn this over to Peter. He's going to come up and he's going to let you understand exactly what you need to do and how you do it so that you can enjoy your life, have a great quality and longevity. Thanks for your time. Appreciate it.